Hello friends, I am Dr. Bhavna. I am a dentist working in Sharjah. So today I thought I will discuss one important topic, that is children's dental health care. This is a topic that most parents ask me about. So it is one of the most important aspects of a child's health, but unfortunately in my practice what I have noticed is it is one of the most ignored aspects of any child's health. Often parents bring their children to the clinic with a lot of rampant decay, sometimes with swellings and pain and everything. And I often ask the parents, why you did not bring this child earlier? Why do you wait till there is such a complicated situation? And parents often tell me that they thought it was the milk teeth and it will eventually fall off, so it did not require any attention. But this is a very wrong concept and a misconception among all the parents. The age that is when the milk teeth is there in the a child's mouth is from 6 months after birth to around 12 years. So this is the phase of the milk dentition and as well as the mixed dentition. This is the age that a child or any person in their life achieves maximum growth, both physically as well as mentally. So in this age, if they have a bad teeth, it will adversely affect their physical growth as well as their mental growth. If you have decayed teeth, it will adversely, you cannot chew properly, the child will have difficulty eating, it will affect in turn their nutrition. Also, if they are having pain, they will totally avoid eating food. Further, if the front teeth of the child is black or decayed or broken or missing, this will affect their confidence. This is the age children make their first friends and they go to their first school. So if they have bad teeth, it will surely affect their self-esteem, and parents have to do maximum to save and make sure the children have good teeth at this age, so that it will contribute to their mental growth as well. Also, another important thing why we need to save this milk teeth is so that the permanent teeth comes in the correct position. If we remove the milk teeth at an early age, it will lead to the permanent teeth coming in wrong positions. So the next question I often get from parents is, why are the teeth decaying? So the main reason is food and presence of sweet in the mouth. Okay, so at a very young age, say at 6 months to 1 year, if your child is getting decayed teeth, that means the main issue is presence of milk in the mouth, especially when the child drinks milk and often goes off to sleep. So this can be easily rectified, that is just after breastfeeding or drinking milk in the bottle, the mother can just wipe the child's teeth with a wet cotton cloth, or at least give the child little water so that the presence of milk in the mouth is not there. Second important, after a certain age, like after 2 years, the again food is the main reason. Maximum we should keep the mouth as clean as possible, so that less food content in the mouth and will reduce the bacteria. So this is the main issue for tooth decay, presence of sugar in the mouth. So I will suggest a few tips that you can follow to prevent decay. The first and foremost is brush twice a day. This is a habit that the parent has to inculcate from a very young age. So brush twice a day. They can use a soft brush and a fluoridated toothpaste. So if the child is less than 3 years, you can just smear the paste on the brush, and above 3 years you can use a pea-sized amount. So if you inculcate this habit of brushing twice a day from a very young age, most probably the child will not have decays in future. The second most important thing is making them wash their mouth after any food. See, let it be a chips or a biscuit or some snacks or food, breakfast, dinner, anything. After they eat their food, it should become a habit that they have to go and wash their mouth, or at least drink some water after that eating that food, so that the presence of food in the mouth is limited. If there is no food in the mouth, there is less chance of decay. The more time the food is in the mouth, the more chance bacteria comes and the more chance decays are starting. Okay. The third important thing is healthy food for the child. So this is something very important for all of us as parents to control, because the markets are flooded with processed food, chips, chocolates, biscuits, juices. So it's very difficult, but as much as possible in the house, try to give the child healthy, fresh and raw food, both fruits as well as vegetables. Maximum make the child, train the child to eat them in the raw form and give them more home food. So if we follow such healthy food in our house, automatically the child will also be learning to eat such food. Okay. Often parents tell me, I am making juice for my child and giving. There is no necessity. After 2 years, the child has 20 milk teeth in the mouth, and the child can chew and eat their food. So there is no need to grind the food and make them eat soft food, or no need to make juices for your child. Train them to eat healthy, fresh and raw food. And the last and most important thing is, at the age of 6 months, once the first teeth comes, or at least by 1 year, please bring the child to the dentist, so that the child and the dentist develop a bond. Okay. Otherwise, suddenly when you come with a huge issue, then it's difficult for the dentist to become friends with the child or treat the child. Then lifelong they will have a they will not like the dentist, or they will be afraid of going to the dentist. So when the child goes to the dentist from a young age, the dentist can teach them good habits like brushing the teeth, flossing, taking cleaning the tongue, and all these things can be taken care and taught to the child at a very young age. Also, if there are any small decays that are starting at a young age, the dentist can clean it immediately and make fillings at that age, rather than doing complicated treatments like pulpectomy or removing the milk teeth at a young age. So these are some of the simple tips that you can follow to take care of your child's dental health. I hope this is useful for all of you. Thank you.